Hello and welcome to this evening's webinar on how to engage in the healthy weight and lifestyle conversation. As highlighted, my name is Stavroula Zandes, Stav for short, a lot easier to pronounce, and I have a background in psychology and counselling and also over 20 years experience in public health and in particular working with the Cancer Council of Victoria in tobacco control in a range of roles. So not only just counselling on the quit line, but also training clinicians such as yourselves on how to engage in the behaviour change conversation. And this work inspired me to now run my own education and training business, which focuses on a range of health and wellbeing and lifestyle topics, but also communication skills and in particular motivational interviewing. I also currently lecture at Monash University in the School of Public Health and Preventative Medicine, and I'm also currently collaborating with the Cancer Council of Victoria on their Live Lighter program as one of their principal trainers. As part of my welcome, I would also like to acknowledge the traditional custodians of the land that we meet on today, and I'd like to pay my respects to the elders both past, present and future, and also acknowledge my respect to any Aboriginal Australian who is here today. So a very big welcome to you all, and thank you for joining us this evening, taking time out of your evening to spend the evening with us on this session about having the healthy weight and lifestyle conversation. So just acknowledging that I'm the principal trainer. I co-developed this training program with the Cancer Council of Victoria's Live Lighter program. And initially we did start off with a 2-hour session, and we then had additional requests to run a full day training. And as part of that full day training, we also add additional information on medications as well as mental health populations and how can we support them moving forward. So we are running a 1-day training tomorrow, and I know it is short notice, but if you're interested in coming along, feel free to come along. But I think I will be back again in the future to run some additional training sessions. So in terms of this evening's webinar, what I will be doing is starting off by highlighting the scene and setting the scene and highlighting why it is important that we put obesity and this topic on the agenda, and that we do engage in conversation with our patients about it. We'll look at behaviour change and how do we engage in the conversation in a very supportive and respectful way. And as part of that, I'm also going to introduce you to motivational interviewing. And then the second half of the webinar is very much looking at some practical strategies. And in particular, I'm going to take you through the Live Lighter website, a free resource that you can use with your patients or refer your patients to use to support the healthier lifestyle. It's very practical, it's very easy to navigate, and we have had lots of positive feedback from consumers on using the website. And the last part of my presentation this evening is focusing on the 5 A's. So how we can actually put it into practice in terms of brief intervention. How can I engage in conversation in as little as 3 to 5 minutes? And we acknowledge that you're very pressed for time in clinic, in consultation. So this is a really nice framework for you to be able to present and engage in the conversation quite quickly, but also make some appropriate referrals and do a follow-up if you wish to do so. So I'm going to take you through all of this information this evening, and as Sandra has highlighted, please feel free to ask any questions as we go along. I will at times open it up to you for you to contribute if you can, and it'd be great to hear your thoughts and experiences working in this space. Okay, so let's start off by setting the scene. And we want to set the scene because we want to acknowledge that Australia is one of the most overdeveloped or most overweight developed nations. I often confuse those words, most overweight developed nations, with 1 in 3 Aussies who are currently obese and 67% of Australian adults who are above a healthy weight. So it's starting to become the new normal. And we see this often when we're working with families and their children who are well above a healthy weight, and if we're engaging in conversation with families, often we hear this from parents. They often say, well, little Johnny looks like all the other kids in school, so I'm not sure what's going on here. I mean, I think we're all normal, I think we're all okay. So it's important that we actually start to engage in conversation because obesity is very difficult to reverse. It affects all systems of the body, as highlighted in that infographic, and also is linked to 13 different types of cancers, which I'll touch on in a moment. What's also very important for you is that we can often connect in conversation by the many clinical presentations that come into the clinics, that come into the consultation. So whether it might be focusing on sleep apnea, or maybe you're focusing on joint problems or diabetes, we can actually make many of these connections to being above a healthy weight and well above a healthy weight to help us sort of slot this into conversation quite smoothly without sort of asking an out of the blue question. And we'll talk more about this as we progress through the training. So as highlighted, we know that this is a risk factor. So being above a healthy weight or well above a healthy weight is a risk factor for many, many chronic diseases, including cancer, which is linked to 13 types of cancers, which are again highlighted on the infographic. And it's great to see that there's a lot more advertising in this space and that we're raising awareness in this space, that leading an unhealthy lifestyle, whether it's having an unhealthy diet or lack of physical inactivity or lack of physical activity, can result in an increased risk of poor health outcomes. So it's important that we engage in conversation, and this is why the Cancer Council is involved in this work and is really moving forward to support clinicians such as yourselves to be able to do this much more effectively, much more efficiently, and much more comfortably, because we also recognise that this is a difficult conversation to engage in. Okay, so why do people gain weight? And often we hear, oh, well, it's so simple, energy input versus energy output. There's an energy imbalance, and that's that. But it's a lot more than that. Obesity and being above a healthy weight is much more complex, and so many other factors come into play. So we do have an environment that is obesogenic. Everywhere we go, we are sort of confronted with unhealthy food choices, which are often the easier food choice or possibly the most cheapest choice. So our environment is not actually helping the situation. There are many social factors, whether that's lack of education or lack of employment, maybe it's about poor health literacy. There are psychological factors. Maybe my patient is experiencing poor mental health. Maybe they're experiencing anxiety, and as a way to cope, they're comfort eating. So it's a range of factors. It could be individual. It could be genetics. But also very much society plays a huge role in this space. So it's a very complex issue. It's multi-component. There are factorial interventions that we need to consider. And this is just one piece of the puzzle, us engaging in the healthy weight and healthy lifestyle conversation. What's also important to recognise is that as we age, as an ageing population, we do start to gain weight. And this is quite fascinating when we look at this slide here. For both males and females, at the age of 25, or even a bit younger for some cohorts, we start to gain weight over our lifetime. So maybe the ultimate goal is, if we're working with someone who is struggling to address their weight or lose their weight, we want to really acknowledge that no weight gain is an achievement. How can we help you maintain and stay at this weight without putting any more weight? Because as I've highlighted, obesity is very difficult to reverse. So we want to acknowledge this. We want to encourage this. We want to still engage in conversation with people who are within a healthy weight range. We want to ask those questions. What are you doing to keep so well? And when my GP asked me that question, I was blown away. I actually said to her, what? So, excuse me, I'm sorry. This was way before I was doing this work. And she said to me, I'm just interested in what you're doing to keep healthy. And I remember being quite cheeky, because I said something like, well, you're the doctor, you tell me. And she laughed, and she said, and prompted me, tell me about your dietary intake. What's that like? I said, oh, I'm Greek. I follow the Mediterranean diet. And then she said, well, what about your physical activity? Yes, I'm at the gym very, very often, and I try to get out and about. But she also asked me about my stress levels. How are you managing your stress? And at the time I was doing meditation, so I was able to have that conversation with her. So we want to acknowledge and support people who are within that healthy weight range. What are you doing to keep so well? And we want to have that information, so when that individual starts to put on weight, we can come back to that conversation and we can say, remember that time we had that conversation about how you were managing your stress or your dietary intake? And that was a year ago or a couple of years ago. What's happened since then? And I've had that very recent experience where I have suffered a knee injury, and as a result, I'm not as physically active. The comfort eating has kicked in a little bit. And then when I did visit my GP, we had this conversation about where I was and where I'm at currently and what I need to do to nip it in the bud so I'm actually are able to maintain and not start to increase the weight gain. So I think it's very, very important that we acknowledge this, because often we may overlook this and move on to the next topic or the next sort of area that we must face. But this is a really important one in terms of acknowledging individuals who are within a healthy weight range. So what's actually happening in practice? So we know from the Live Lighter Cancer Council Victoria's data in 2017 that 31% of Australians had been advised by their doctor to address their weight, but most importantly, they were able to recall this, and this is fantastic. They remember the conversation with their doctor, and this is a great achievement on the part of the doctor, because obviously it was done in a way where it was engaging and supportive and encouraging, but also important. It's important that you address your weight, and let's focus on some of those benefits in terms of leading that healthier lifestyle. Some more recent research by Caddison et al. In 2019 also highlighted that it took about 3 years between the time that a person with obesity first began struggling with their excess weight and when they first had a weight management conversation with their healthcare professional. 3 years is a long time, and in 3 years a lot can happen, and often in 3 years weight gain continues to increase. So it's important that we nip this in the bud, that we intervene and we engage in conversation early, so we can actually try and maintain it and look at how else we can address this sort of weight issue, or possibly we might be addressing poor blood or high blood pressure, or maybe it's blood cholesterol levels that are quite high. Maybe your patient's pre-diabetic, so we may want to have a look at exploring that and nip that in the bud. So it's important that we do intervene early. What's happening after the patient has received advice? Well, 40% lost weight and were able to maintain the changes, which is great. However, we must also acknowledge that 50% who lost the weight regained it. And obesity is a chronic relapsing condition. Your patient will unfortunately relapse, will unfortunately put on some weight, sometimes more. So we need to be mindful of this as clinicians. We don't become disheartened. We don't want to get to that point, well, I've told them and I've told them again, and they're like a yo-yo up and down. This is expected. This is normal. And even patients who do lose weight still have those benefits. And what we may even be able to focus on is those benefits to their mental health, and go back and have that conversation about what life was like when you were 3 kilos lighter, when you were within a healthy weight range, when you were a few centimeters, the waist circumference was a little smaller, when you were within the healthy weight range in terms of your, not healthy weight range, but the healthy blood pressure, and so on. So it's important to acknowledge this, and it's important that we continue to offer information and support whenever we're engaging in conversation in this space. So where do our patients get their information from? So there's no surprise there, where 44% will actually go to the internet, Dr. Google. But is Dr. Google evidence-based? So we want to ensure that we support the information with that conversation. But great to see that 34% are visiting their doctor and 17% are visiting a dietitian or nutritionist. Interestingly, as you've sort of moved down the profile there, 5% don't know where to go. And that could also be that they lack health literacy and are not sure how to navigate the system or navigate the information that is online. It is overwhelming. One moment we're told to not eat eggs, and the next moment we're saying, oh no, eggs are okay. So we need to be mindful, low fat, full fat, skinny. What are we telling our patients? It's overwhelming for a health professional, let alone the average Joe Blow who may have poor health literacy. We'll talk more about health literacy this evening as I take you through my presentation. What's also interesting is that 77% of patients feel comfortable talking to their health professional about their weight. And this is very, very supportive and very encouraging, because often as clinicians we think, oh, this is a really sensitive issue, it's taboo, I don't want to go there, I'm going to upset them, it's going to create discomfort, but it's actually quite the opposite. They're very comfortable to have this conversation with you, a trusted, evidence-based practitioner, because the conversation that you're going to have in this space is very different to the conversations they're having with their families or their siblings or their mum about addressing their weight. It's very professional, it's very sensitive, it's very engaging, and you're mindful of the language that you're using, which we'll touch on in a moment, but you're also mindful of body language, which I will also raise in a moment as part of this evening's training. So it's important to acknowledge that you are a respected and trusted source of information, and as part of your role as a health practitioner, you do have a duty of care to connect and engage and provide evidence-based information. By doing so, by engaging in this space, we know that this motivates patients to make some change. 89% wanted to address their weight when their practitioner raised raised it with them in comparison to 61%, and 68% had attempted to do something about it, which is very, very powerful. Sure, you might wonder about those mean weight losses. They're not so high, but again, remember, the ultimate goal for many, many of your patients is to just maintain the status quo, not to put on weight. So even if they're able to lose 500 grams or a kilo, that is a great start. Maybe we're going to focus on waist circumference, move away from the kilos. Maybe we're going to focus on healthy lifestyle choices. They're reducing their sugary drink intake. They're having breakfast on a daily basis. They're increasing their steps per day. These are all great starts to build self-efficacy and build their confidence that change is possible and that change is achievable. And if you look at that last dot point again from the latest study, 81% of persons with obesity had made a serious weight loss attempt, and 37% had lost at least 5% of their body mass. There are huge benefits in losing 5% of your body mass to your pre-diabetic conditions, to managing diabetes, to blood pressure, and so on. You know all this very well, and I don't need to take you through that information. So, having said all of that, and having presented such a strong argument about engaging in this space, this is often not happening. And it's often not happening because clinicians and healthcare professionals often lack the confidence. Often they're saying things like, I want to Stav, I want to engage in conversation, but I don't know what to say. I don't know how to say it. I don't wish to upset my client. We have good trust and rapport. I don't want them to, walk away thinking I have no understanding of what they're currently going through. Often it can be very difficult, and it is very difficult working with patients who are in denial about their weight issue or are reluctant to hear your advice. Maybe they're defensive, and maybe they start to comment on your weight, and maybe they might say something like, well, Stav, you could lose a couple of kilos yourself, so I don't know why you're banging on about me addressing my weight. Don't be alarmed about that. Acknowledge it and say, yeah, I know, right? The struggle is real. I too am a work in progress, but today is not about me. Today is about you and how I can support you to move towards that healthier lifestyle so we can improve your blood pressure, we can reduce your cholesterol, so we can reduce your risk of having a heart attack or developing diabetes and so on. I don't want to bore you with my issues. I've got plenty, but today is about you. So acknowledge that the struggle is real. No one is perfect. We're all trying to make lifestyle changes that are positive, even if it means trying to drink less coffee or spend less time on the internet. We're all trying to work towards positive lifestyle choices. So despite all of this, there are professionals who are not 100% sort of comfortable in this space, and that's how we decided to design this training, to highlight that all of these challenges can be overcome by focusing on the behaviour change principles, which I'll take you through in a moment. I'm going to share with you some practical strategies for you to take back to practice when you're working with your patients. I'll highlight this 5A's structural framework, which will make it easy for you to present this in practice. It's a really nice structure, provides brief intervention, and of course, highlight the information and support services available. So let's start off by focusing on the process of behaviour change and reflecting on how do we engage in the conversation. So I want to pause for a moment and handball it over to you. And I want you to think about how you engage and communicate with your clients. What do you say or not say? What's your body language saying? What words are you using to support and engage in this conversation? So I might pause for a moment and ask you to reflect on this question. And if you can, I'd love for you to actually type in some of your thoughts about how can you engage effectively in this space. And please don't be shy. I'd love some interaction from you, and I'd love to hear from you. How are we going, Sandra? Any thoughts, any comments? We're all gone quiet? They're still thinking. So while you're still thinking, let's move forward. One of the main points that I want to highlight is the word should, because often this can slip into conversation quite naturally. We may not even have sort of realised that we've used the word should. We often use it with our families and our partners, but it's a very, very powerful statement if I'm saying something like, you should lose weight, you should stop smoking, you should manage your blood pressure better and take your medication. What happens when we tell people what they should be doing? What happens when I tell you what you should be doing? Our defenses go up, we dig our heels in, And I start to think, well, who are you to tell me what to do? And in fact, I'm going to do more of the opposite of what you're suggesting I don't do. So if you're telling me to quit smoking, I'm just going to smoke more. If you're telling me to keep, address my weight, well, you have no understanding. So if you sort of try and catch yourself, I'm hoping that you don't use the word should, but I often work with many clinicians who do. So reframe to could. And all you're doing here is asking your patient, what could you do instead? What could you try? Or could you try increasing your steps per day? Could you try reducing your sugary drink intake by 1 can of soft drink per day? Now, what could you do? So all we're doing is just reframing that word. And what we're doing with the word could is honouring the client's freedom of choice. So we're giving them permission to reflect on what they could or could not be doing and leaving it up to them. It's a decision that they're going to make, but we're just sort of starting to plant the seed of what they could possibly be doing moving forward.
Stav, we've had a couple of comments come through.
Great.
So one person is saying that they would talk about carrying excess weight and the impact that that has.
Great.
And another said that they would ask the patient to think about what is an achievable goal for helping them to lose weight and start from there.
Yeah.
And the last comment that came through was about asking what they've tried previously.
Nice.
And identifying any barriers that they might have faced.
Great, great. So thank you for sharing those suggestions, and they're very spot on. It is really important to identify their barriers, to identify concerns, what gets in the way. So we'll touch on that this evening. And it's also important to work with the patient in collaboration. What is the goal that you would like to achieve, and how can I support you to move towards that goal? It's also important that we are realistic, because the patient might say, well, I want to lose 30 kilos. And yes, that may be all very well and good, but how about we focus on losing a couple of kilos to start off with? Because if I'm reflecting on, oh my gosh, how am I going to do this? That can be very, very overwhelming, and I may give up quite quickly and quite easily when I'm not seeing positive results quickly enough. And we are very funny creatures, us humans, because once we've made that decision that I actually do want to make some change, I do want to address my weight, I do want to quit smoking, I want it to be quick, and I want it to just be done and over it with. But as we all know, change is difficult. Change takes time. We're going to take a step forward and a couple of steps back, and relapse is very common. So we just want to be mindful that let's focus on taking some baby steps. Let's focus on what we could be doing in the short term. And absolutely, that is the end goal, the 30 kilo end goal. But let's just focus on 2 or 3 kilos for the moment and build from that. And that's a really nice way to build your patient's self-efficacy that change is possible. So as clinicians, what we want to do in practice is do more than just give information. We want to do more than just educate, because they're going on Dr. Google, they're going on the internet, and they can read the information online or in a medical journal if they're that way inclined. So we also want to empower our patients that, it is possible for them to make change. And as part of our communication with them, we also want to reflect on our assessment skills. And what we mean here is, I'm not reflecting on, well, I need to assess whether my client is above a healthy weight. You will already know this, you will already do this. But what I want to do here is to assess my client's readiness to change. How ready are they to take the first steps, and what are they prepared to do? I'm assessing their level of confidence, because they may be ready, but they lack total confidence. I'm assessing their barriers. What gets in the way of you doing some physical activity? What gets in the way of you having a healthy breakfast first thing in the morning? I'm assessing their learning preferences. How is it that you learn? Do you like to read something? Are you more of a visual learner? Do you want to sort of listen to a podcast? How do you learn? So we want to make an assessment pretty much holistically of the person and how they feel and what they think and how they learn, in order for us to then tailor our approach and tailor the information we're presenting in a much more sort of user-friendly way. As part of this work, what we're aiming to do is provide client-centered care. And when we're doing motivational interviewing, this is exactly what we're doing. The client is driving the agenda. Now, you might think, oh, hang on a second, I've got my agenda and I need to get through this X, Y, and Z. Absolutely. But when we're doing motivational interviewing, the client is driving the agenda, because it's all about them and their priorities and their concerns. But what I'm doing as the practitioner is subtly also driving the agenda, subtly towards a common behaviour change goal. And I'll talk more about this when I introduce motivational interviewing in a moment. So when we are having these conversations with our patients and when we're engaging in a very respectful and supportive way, we need to be mindful of weight stigma. And most people who are above a healthy weight and well above a healthy weight do often experience weight stigma or discrimination or prejudice because of their weight, whether it's in the media, whether it's in the workforce, whether it's from social and family relationships. So we need to be mindful that as a professional, that I'm not going to create any weight stigma when I'm having this conversation with my patient. And so Rebecca Poole et al. Has done some research in this space with doctors in terms of some of the terminology that they're using. And what she found and her colleagues found was that they were able to identify some least stigmatizing language and the most stigmatizing and also the least motivating. And as you can see there on the right, the most stigmatizing for your patient is to call them fat or to say something like you are morbidly obese. And the same goes for the least motivating. If I'm calling you a bit of a chubber, well, that's not going to motivate me to then take some action moving forward once I leave your practice. So we want to keep our language neutral and say something like an unhealthy weight, or let's have a look at how we can achieve a healthy weight. I like to use the words above a healthy weight and well above a healthy weight, so implying that obesity is well above a healthy weight. But let's focus on lifestyle choices. Let's focus on what we can be doing moving forward. You might also want to ask your patient, you know, what words would you like me to use? But even if they say, oh, I don't mind, doc, if you call me chubber, I will not go there. Let's just focus on keeping it neutral in order to engage in conversation in a very respectful and supportive way. We do know again from the research that with weight stigma, and especially in this particular study where the focus was on women who experienced weight stigma, that this is a stressor. And how do they cope with this stressor? They turn to eating. Eating is a common coping strategy. It's a coping mechanism. It's their comfort eating. We don't want this with our groups, with our cohort, with our patients. We want them to be able to manage their emotions in a very healthy and productive way and not return to food to help them manage. So we need to be mindful of this and mindful of the language that we're using. And, you know, I've done many, I think I've been doing this now for 5 or 6 years, training GPs. And I'll never forget one doctor who said in training, oh, you know, I steer away from the word obesity. I got caught out once. The patient misunderstood what I said. So I think he said something like, you are obese. And she thought he said he was calling her a beast, a beast. And the whole conversation derailed and she ended up crying and it was awful. And he made such a strong statement about not using that word obesity with our patients. Absolutely, in a clinical setting, we do use the clinical word, but when we're working with our patients, we really want to steer clear away from that type of terminology and use more neutral language. The results, if we don't, are many consequences, both psychological, both physical, medical, so it compromises their overall health care. In fact, the research shows that, let me just get my statistics here, because I think it's about 42% won't go back. And I think, let me just find my stats, because they're very, very powerful stats. And I want you to remember these stats moving forward. So let me just find them. If you just give me a moment. Where have I got my stats? Okay, so this is in clinic. This is having conversations with doctors. The potential reactions are that 42% of your patients will feel upset and embarrassed. 35% will seek a new doctor, and 24% will avoid future medical appointments. This is disheartening, it's distressing that possibly now our patient is not accessing any medical care for their condition, especially if they have chronic ill health and other chronic conditions. We want them to engage in the healthcare system and we don't want them to walk away seeking a new doctor. So please be mindful that this can have a huge impact, both psychologically, but also both physically, but also they just don't come back. Psychologically, we know it can lead to increased anxiety and depression, low body self-esteem, low body image, thoughts of suicide. So I often now focus on mental health concerns. And when I'm having these conversations with patients, I reflect on how could we improve your mental health? And what we know from the research is that being able to address your weight or living this healthier lifestyle improves mental health for all of us. So I put myself in that category as well. And this can be very, very powerful when we're engaging in conversation about improving someone's overall health and well-being. So use the neutral language as I've highlighted. There are a couple of sort of key questions that you could ask. Could we talk about your weight today? Or you might even ask, I'd like to talk to you, or I'd like to talk with you about your weight. Is that okay? So I'd like to talk with you about your weight. Is that okay? I'm asking for permission. In over my 20 years experience, no one has ever said no. Even the angry client was, all right, Stav, all right, what have you got to say? We're too polite. So is it okay? And if they say, well, no, it's not okay, don't be afraid to ask, well, tell me more about what's going on for you. Tell me more about this. And I'm here to support and help you, and I respect your decision, but tell me more. And that's really powerful. Tell me more. Help me understand your situation, where you're coming from. So another really powerful question is, how do you feel about your weight? And a little bit later this evening, I'm going to play a video with a doctor and a patient who he wishes to address his weight. And he just asks him, how do you feel? It doesn't even say, how do you feel about your weight? And it's very, very powerful. And the last dot point, what words would you like me to use? I'm not a real fan of that one. It's, personal preference, however. But if you feel that would feel good for you, or you feel quite comfortable asking that question, then I encourage you to do so. But I find that the first top two are quite nice. The second one is an open-ended question, and it will give you a lot of information, a lot of data about how your current client feels. You might even be saying something like, what do you think about exercise? How do you feel about exercising? What's your definition of exercise? Because the moment I say exercise, people think, I'm not going to a gym. No, I'm not asking you to go to a gym. I'm asking you to possibly increase your steps per day. So these questions can be very, very powerful to help us engage in conversation quite quickly. So some other communication tips are obviously motivational interviewing. I don't have time to take you through some of those key skills and principles, but I do encourage you to do some additional training in this area. And if you're ever visiting Melbourne, please feel free to come along to my training sessions on motivational interviewing. All we're doing here is really developing the discrepancy between the client's current situation and the desired situation. We're focusing on barriers, but we're also tapping into that emotional energy. How would it feel to be able to achieve this goal? As part of motivational interviewing, we're also showing empathy, we're avoiding arguing, we're rolling with resistance and so on. Some other really helpful tips and ideas that I encourage you to reflect on is your body language. How do you have this conversation with your patients? Is there a barrier between you and your patient? Is there a desk? Are you sitting behind a computer and your patient is seeing the back of your computer? And just recently, my doctor has rearranged her office, and it is amazing because now I'm sitting next to her and I can see everything that she's typing in to her laptop, her computer. So if I just sort of show you, she sits there and the laptop is there, and I'm sitting here as a patient and I'm actually looking at her on the side and looking at her laptop. And it gives me as a patient so much power because I could see that she was typing in our conversation and I could see exactly what she was typing in. But then I was scanning some of those biological markers and I said, oh, what's that? It's red. Why is that red? And she said, we'll come to that in a moment, Stav. Your iron is low. We'll come to that in a moment. But I felt so good being able to reflect and ask those questions. And all she did was rearrange her desk so I could actually see what she was typing into the laptop. So it's very, very powerful. I really also encourage you to use terminology such as I encourage and I recommend, and this is what I'd suggest. What do you think? So you plant a seed, this is what I suggest and this is what I recommend, but what is it that you think about this? How do you feel about that? Because you may make 1,000,001 suggestions and your patient will say, I've tried that, it doesn't work, I feel like a failure, nothing works for me, it's in my genes, it's in my family, and then the reasons start to pile up. So plant the seed, present some information, and then ask them to reflect on, how does that sound? What do you think about that idea? How would this fit into your current lifestyle? We also want to repeat key messages, especially the important ones. And we do this because our attention spans are just getting shorter and shorter. And in consultation, what we know is that my attention span peaks. So when I come into clinic and it's, you know, I'm alert and I'm listening and everything that you have to say, but in the middle of the conversation, my attention starts to drop. I may start to think about what I'm having for dinner, what I'm doing over the weekend, and then my attention starts to peak again at the end of the conversation. So if I want you to reinforce key points at the start and key points at the end, or you might also do what we suggest is the teach back method, where you ask your client to teach you. And so my physio did this recently with me, and he said something like, so when you go home to hubby, and I said, yes, what will you tell him about your knee? And I went, oh, what will I tell him about my knee? Very powerful. Now, I did panic initially, to be honest with you, because I just lost concentration. He was talking about the knee and the muscle, and we've got to strengthen the muscle, and using these words when I just stopped concentrating on what he had to say. So initially I thought, oh no, I don't think I was paying attention. What will I tell hubby about my knee? And why is it important for me to do these physio exercises? I was able to manage to get something out. There were some gaps in my knowledge, and he was able to then fill in those gaps for me to feel much more confident as to the reasons I am doing the physio exercises, and not just doing them for the sake of doing them, because that is not sustainable. Behavior change is not sustainable until or unless there is a strong intrinsic why as to why I am engaging in this type of behavior. So the teach back method, the client is teaching you, or the show me method. If you're taking through someone the asthma, what's it called, the ventilator, ask them to show you how to use it. If you're asking people to take their medication and they've got lots of packets there, ask them to show you and to describe to you what are all these medications for. And I recently did this with my mother-in-law, and she had no idea. She said, oh, I think that one's for blood pressure, and I'm not sure about all these other medications, what they're for. So she's taking medicines without realizing what they're for. So the teach back method, a very, very powerful way for you to assess knowledge and, you know, sort of key takeaway steps moving forward, but also to assess their health literacy, because we know that in Australia we have a problem with health literacy, and in fact 60% of Australians have poor health literacy. This means that 60% of Australians will initially struggle to find the information that is evidence-based. So they'll struggle to find it. They'll go on Dr. Google. They'll believe some quack about taking some pill that will help them lose 50 kilos. And they'll struggle to actually make heads and tails about what this is about and whether it's accurate and so on. So number one, they'll struggle to find the information. Once they've found it, they'll struggle to read it, to understand it, to process it, to apply it. So it's important that we're mindful that we don't use medical jargon. We don't make assumptions about people's level of understanding. Even the word sodium, people do not make the connection that sodium is salt, that poultry is chicken. Hypertension. Are you saying that I'm, you know, sort of, you know, oversensitive? Well, no, I'm talking about high blood pressure. You know, people don't make these connections, so it's important that we check in with them, their level of understanding. And I was reading an example online which demonstrates this quite strongly, where a man was in hospital due to managing his diabetes, had high blood sugar readings. Whilst in hospital, the hospital staff were teaching him how to inject, but they were doing this by teaching him how to inject into an orange. You can see where this is going. He's then released from hospital, and all of a sudden he's back in hospital with high blood sugar readings. What happened? They said to him, you're doing so well in hospital. And he said, well, I did exactly what you asked me to do. I injected into the orange and then I ate it. So you think, oh dear. So when people are feeling vulnerable, when they're feeling anxious, when they have poor health literacy, they may take things literally. They may not understand the connections. So it's important that we actually fill in those gaps to be able to support behavior change in the long term. You know, why am I doing this? Why are you encouraging me to address my weight, to address my blood pressure? You know, what does diabetes even mean? And like my mother-in-law, there's type 2 diabetes, doesn't understand it. We ask her, well, I ask her, you know, what's your understanding? I don't know. Am I allowed to eat fruit that has sugar in it? So it's important to reinforce those key messages and never make assumptions about people's level of knowledge. So keep it as simple as possible if you can, and this is going to really support the conversation moving forward.
Sorry, Steph, we've just had a comment come through from Vanessa, and she's saying, why do we skirt around the topic we don't ask people how they feel about having cardiac drugs, insulin, etc. when they are non-compliant. We stress the importance and the effect of their overall health.
Yeah.
And are we unwittingly adding to the problem by not being direct?
Yeah, exactly. So thanks for raising that. And I am all for it. In fact, I often say to clinicians in training, and I should have mentioned this, if you don't say something, if you don't raise it in conversation, what exactly are you saying with your silence? And in fact, with your silence, what you're saying is you're okay and it's okay and you'll be fine when we know that it's not fine. So I'm not sure, and you know, we used to have this conversation about tobacco over 20 years ago. I remember training clinicians who would often say to me, I'm not asking about smoking, let alone encouraging people to quit. No, that's their business, it's taboo. Oh, I smoke myself. And it's like, but yeah, but they've just had a major cardiac event. How can you not ask them? How can you not encourage them to quit smoking? And I feel that's where we're at now. We're skirting around the issue. We're not having these conversations, but it's important that we do because it affects so many body systems. It increases our risk for, you know, cancer and heart disease and diabetes, and also has poor health outcomes in terms of our mental health. So every time you feel a little nervous about whether to approach or raise it in conversation, always remember me asking you, what are you exactly saying with your silence? And are you saying that it is okay? And especially if you're working with families whose children are above a healthy weight, because that family is going to walk away and think that little Johnny is okay, but in fact, little Johnny is above a healthy weight. And we'll talk more about children and families when I look at the 5As, and I'll highlight some work that I've been doing in this space with New South Wales Health to engage in the conversation. But thank you for raising that topic. It is a very important one, and it's important that we keep moving forward in the direction of supporting lifestyle and, you know, really improving people's health and well-being. So as part of our communication, we're also assessing readiness, and I'm going to assume that you're familiar with the stages of change model, which was initially developed by two psychologists who were focusing on addiction, and what they realized that often people will go through a series of stages of change. And it's not necessarily that you sort of work around this cycle. You initially might start off with being a pre-contemplator. This one works, yep. And then you might find that you've actually moved into the action phase quite quickly. And often what happens here is that you may have had a health scare, you've had a major cardiac event, now you're in hospital, and now you're starting to think about addressing your lifestyle. What we do know, however, from the behaviour change research is that most people are here. They're contemplators. And I often call this cohort chronic contemplators, because they've been thinking about addressing their weight for 5, 10, 30 years. I just haven't got around to it, or I've tried and I've failed. And so often people are stuck. And what we're aiming to do is really support them to move forward and help them start planning and preparing and start taking small baby steps towards a positive goal that we're working towards. So we're encouraging they take some action. Ideally, what we're aiming to do is be able to help them maintain it in the long term. But as I've highlighted, obesity is a chronic relapsing condition. Most people will go back to former behaviour time and time again, take a step back, take a step forward, a couple of steps back, and so on. We just want to keep engaging in conversation. We want to actually highlight what was that trigger, what led you back to former behaviour. What could you do differently next time? How can I help you? Maybe I could refer you on to a dietitian, so we start exploring your dietary intake. So always engage in that conversation about what you could be doing differently. Always come back to that question, how do you feel about addressing your weight? How do you feel that you do have high blood pressure? How do you feel about increasing your steps per day? How do you feel about reducing your sugary drink intake? So tailor it accordingly to the patient that you're working with and also what you feel comfortable with. Now, regardless of stage of change, always engage in conversation. Often in the past, clinicians will say, well, they've just told me they're not interested. Why would I even go there? But you must go there, because even pre-contemplators can enter treatment if it is raised in a very supportive and engaging way. And we have strong research from smoking cessation to support this. And we're now assuming and applying this research to the healthy lifestyle and healthy weight conversation. If you approach it in a very respectful way and plant the seed, this may be just exactly what this particular patient needs to start thinking about it. That's the first step. Okay, I'll think about it. I'll go away and reflect on it, and maybe I will take some action. And don't underestimate the difference that you can make just by planting the seed when you're working with a pre-contemplator. Who are these pre-contemplators and what can we do? Well, they're often the patient who's in denial. They're often the patient who says, look, I've just got bad genes, all my family is big, I'm just big boned, it's part of my culture, everything we do revolves around food, and it's actually, as part of my culture, they might say to you, a fat baby is a healthy baby, it's good. So lots and lots of reasons why people might fall into that category. Maybe they're afraid of failing yet once again. So what can we do? How can we help them? It's really important to focus on benefits. So yes, you can touch on how being above a healthy weight affects their current lifestyle, affects their quality of life, affects their mental health. Focus on the benefits. Focus on what life could look like if you were to make some healthy changes. Focus on mental health and improving mental health, but also explore this possibility of change. Have they ever been, successful before? Have they managed to manage their weight? And what was that like for them? So have those conversations, have those reflections, but keep it brief. I hear you loud and clear that you don't want to address your weight at this stage, but I would like to highlight, if it's okay with you, just a couple of points that I think is really important. I care about you. I'm concerned about you. And I would like us to have this conversation. And is that okay? So I'm just sort of planting the seed, but also acknowledging that I don't want to push because I don't want my client to feel that I'm telling them what they should be doing. So it's important that when we're working in behaviour change, that we actually acknowledge that most people will experience inner conflict, whether this is about addressing weight or addressing smoking or addressing gambling or whatever it might be. This internal conflict can be quite painful, and often it's projected to the clinician as, I'm a difficult patient, I'm a patient who's resistant, I'm a patient who's in denial. But in fact, maybe I'm just the patient who's experiencing this internal turmoil, this internal conflict, this ambivalence about making some change or staying the same. And so I often call this internal conflict as the devil and angel conversation. On the one hand, I'm saying, I really must address my weight or manage my diabetes, or I'm going to lose my foot, or I really must address my knee pain. And then on the other hand, I'm saying, oh, but it's too hard, and I've tried and I've failed, and I can't, and I'll probably put more weight on, and oh, I'm too tired to do the physio exercises, and can't you just massage my knee and it's all over? So I've got this sort of devil and angel conversation, and I could be having this conversation 5, 10, 30 times a day. Then a clinician might come along and tells me that I should lose weight, and that's it. Now I'm just going to, dig my heels in. I'm going to put the barriers up, and I'm just going to say, leave me alone. I'm not interested in having this conversation with you. I've got more other pressing issues to worry about. So we just want to be mindful that your patient may and probably will be experiencing this internal conflict. So how do we manage this? How can we actually work with this and work towards a positive behaviour change goal? The best way to do it is to actually reflect on pros and cons. So what's going well for you right now and what's not going so well? So, what are some of your reasons to stay the same? And this is an odd question because your patient might be thinking, well, I'm not sure what you're asking me. So I think there are no good reasons, but I want my patient to tell me rather than it coming from the clinician. It's much more powerful when your patient actually shares this information with you. And so some of their reasons not to change just might be, well, I'm comfortable. I've been like this all my life. It's way too hard now to make some changes. Actually, I do a bit of comfort eating. That's how I manage my anxiety or my stress. It's expensive to eat healthily. I've always been big. So these might be some of my reasons to stay the same. They may say them to you overtly, or they may be just quite subtle. Well, I've always been big, so what's the point? All I'm doing here is just capturing some information that I'm going to use as ammunition. I'm going to use as data to support the behaviour change conversation. And I use this as data because often it is these reasons not to change that are often get in the way. They're often the barriers, they're often the concerns. So if my patient is telling me that they're an emotional eater, I'm going to have to tackle that or refer them on to a counsellor. If they're telling me that eating healthy is expensive, I want to debunk that myth and have that conversation. We'll talk about how you can through the Live Lighter program in a moment. So I want to use this as data to support the client moving forward. So I then say to them, well, okay, you've got some really strong reasons to stay the same and not address your weight. But if you were to think about addressing your weight, or think about managing your diabetes, or think about lowering your blood cholesterol, what might be some of those reasons to change? So be as specific or as vague as you like, because your patient will come up with what's important for them. And so some common responses are, I just want to look good. Maybe I've got a wedding that's coming up. Maybe I want to just play with my kids. Maybe I'm feeling embarrassed about feeling short of breath. So I just, want to feel good. Now, these are very broad areas. What does that even mean? So if you look at this sort of table, and if you're doing this visually on a piece of paper, don't underestimate how powerful this is on a piece of paper. Grab a blank piece of paper, write up their pros and cons, or get them to write down their pros and cons. You can do this individually. You can do this in a group setting, and it is very, very powerful. Having said that, most of us are visual learners. So when I look at this, I think, sorry, doc, I've got so many good reasons not to change, and only a couple there on the right. So I need to be clever as the facilitator of change. I will need to actually really expand that section, reasons to change. So I might say something like, well, you've mentioned that you really want to look good and feel better. What does this mean for you? And then they might say, well, to be honest with you, I just want to fit comfortably into my clothes. I can't afford to go up a size. Maybe I just want to have more energy. Maybe I want to be a good role model, because true story, one patient said, because my children are embarrassed. They asked me to drop them off a block away from school. And, I don't want that. I want to be able to be a good role model. I want to have this strong connection with my kids. It's their reason, not mine. As a doctor, you might be thinking, oh, we've got to, get your diabetes in check, or, manage your heart disease, or whatever it is. That's what you're thinking as a clinician. And yes, that is very important. But what's your client saying? What are they saying? What's important to them? This is where we develop their intrinsic motivation, their internal why. Because if it's external, because my doctor asked me to, or my partner is nagging me, behavior change is often short-lived. It's short. I may do a little bit of, something positive, and then I just give up because it's not intrinsic to me. So I really want to focus on any of these aspects. What does it mean that you're tired of being teased about my weight? What does that mean? You're talking about having more energy. What does that mean for you? So dig a bit deeper. I want to reduce my risk of ill health. What does that mean? I just want to improve my mental health. It's, the anxiety is crippling me, and I'm comfort eating, or whatever it might be. We want to draw out this part of this behavior change aspect much more strongly. So I touch on the first aspect, and then I reflect on reasons to change, and I spend a little bit more time here. And then I might say something like, thanks for sharing. Wow, we've got some great information from, reasons not to change and reasons to change. Having thought about what we've discussed now, how would you like to proceed? What is it that you want to do? Because you've got some great reasons to stay the same, but you've also got some great reasons to change. What is it that you want to do? And then I'm going to go silent and ask the patient to reflect. And most often than not, they say, well, I probably should do something about my weight. Very rarely, I might have someone who says, it's still not a good time. And if they say it's not a good time, there's often a deeper reason, and it might be stress. So they may share that information with you, or they may not. So they may say something like, I'm going through a restructure at work, and currently I'm struggling, or my marriage is breaking down. I'm fighting in court over my kids. Your patients aren't going to address their weight or their smoking or whatever if we don't tackle the stress. If they're telling you, I'm sad, I'm struggling with grief, maybe their partner passed away a year ago or two, and they're still struggling with grief. Maybe they've had a miscarriage, they're still struggling with grief. Maybe they have post-traumatic stress. Maybe they were abused as a child, and being above a healthy weight is insulation, it's protection from being exposed. Because if I lose the weight, then that's going to attract attention from the opposite sex or the same sex, and I don't want that. Deeper issues. So it's important we refer on to psychologists and counsellors to help explore and tease that information out a bit further. This is a very powerful tool that you can use for any behaviour change, whether it's smoking, whether it's gambling, whether it's not taking your medication, whether it's doing any particular type of physical activity. So I encourage you to use this activity. It's very, very powerful. And I encourage you to reflect with your patient. What is it that you'd like to do now? Where to from here? Make a note of it and touch base again next time. You may just want to focus on reasons to stay the same for this conversation and then touch on some reasons to change in the next conversation. You don't have to do it all together. If you do, it's much more powerful, but you don't have to do it all together. You can always come back to the conversation in a future consultation. Often in this space, I hear, well, I don't have the willpower to succeed, and or, you know, my willpower is quite weak at the moment. I'm not motivated. Now, willpower is a very interesting sort of concept, because willpower comes and goes. It's up and down. We may have amazing willpower on a Monday morning where I'm going to quit smoking, cut the drinking, you know, increase my physical activity. But by the end of the day, I get what we call decision fatigue, and I'm so exhausted, I'm just going to smoke and drink and just watch TV and eat a packet of chips. So let's reframe willpower to want power. So when your client is saying, I don't have the willpower, I often say something like, well, that's an interesting concept, but let's focus on your want power. How much do you really want to change? How much do you really want to manage your diabetes? How much do you really want to reduce your sugary drink intake? And I'm not afraid if they say, well, actually, I don't want to. And then I'm going to do a bit of exploration. Let's look at those pros and cons again. Let's look at some of those benefits, but also acknowledging that this is their decision and I'm going to step back, but check in again next time to see how they're progressing. So I want to focus on their want power, and I might even use a scale from 0 to 10. How much do you want to address this? And from a motivational interviewing perspective, if they say 3 out of 10, I'll say, okay, so can you tell me why you gave it a 3 out of 10 and not a 1 out of 10? And it's quite powerful if you think about that question. Why did you give it a 5 and not a 3? Why did you give it a 3 and not a 0? And what happens here is that your client starts presenting the arguments for change. They're presenting the arguments for change, not you. Because if we base it on a couple of psychological laws, I learn as I hear myself speak. So I'm learning as I'm processing and as I'm presenting the information about what it is that I want to do, because I believe in my own truth, so I'm learning. But it's also based on another psychological law, that what you tell me as my doctor, as my clinician, I consider suspect. And I consider suspect because, hey, you're my doctor. You're going to tell me what to do, and you're paid to tell me what to do. So what you tell me, I consider suspect. But hey, what I tell myself, I consider gospel, because I believe in my own truth. So encourage your patients to present the arguments for and against, say it out loud, because they're going to present the arguments for and against, and they're going to present the arguments to work towards that positive behavior change goal. It is very, very powerful. As part of that want power, we also want to reflect on our patient's skills, because I might say to you, yeah, doc, I do want to do this. I am keen. I do want to manage my diabetes. I want to reduce my blood pressure. I'm afraid of cholesterol. You know, yes, I want to do this. So, but I don't know how. I don't know what to do. You're asking me to eat a healthy diet. What does that even mean? You're asking me to have breakfast. What does that mean? Coffee and a muffin on my way into work? So we want to build our patient's skill set. Do they know how to boil an egg? It's as basic as that. And the Live Lighter program will help you highlight this to support your patients with healthy cooking and learning new skills to increase their motivation and to increase their chances of being successful with this positive lifestyle change. So we're aiming to strengthen the client's motivation to change. They're presenting the arguments for and against. And what we're aiming to do is really develop that discrepancy. As part of developing that discrepancy, you know, that for and against, that devil and angel conversation, what I'm aiming to do is actually create discomfort. Without discomfort, there is no change. And we're all creatures of habit and routine, and we love comfort. We love just doing things as they are. But once we start to shake those feathers a little bit, we don't like it. We think, oh, you know, I need to start thinking about this, or I'm really upset about this at work. And so we're creatures of comfort. But in order for behaviour change to be activated and for it to be successful in the long term, we have to create this discomfort. And we create it by highlighting the discrepancy. So if I use myself as an example, what the physio did with me was he said something like, so Stav, on the one hand, you're saying that you want to reduce your knee pain so you can get back into the gym and get back into exercising. But on the other hand, you're telling me you're too tired and you're too busy to do the physio exercises. So what is it that you want to do? Because on the one hand, you're telling me you want to reduce the knee pain. And that was very powerful. So the physio did motivational interviewing with me, and I didn't realize it until I got into the car and went, oh my gosh, that cheeky bugger. He did motivational interviewing with me, and I didn't realize it because I was doing most of the talking. It was all about me, what I wanted, how I felt, what I thought. It was all about my frustration with the knee and not getting better. And all he did was say something like, help me understand what I think I'm hearing. He highlighted those pros and cons very quickly within a minute or two, and then asked me, what is it that you wanted to do? I remember going bright red. I was so embarrassed. And I said to him, well, obviously, the physio exercises. And I've been doing those physio exercises every day and have been able to reduce the knee pain. So don't underestimate the power of motivational interviewing and the power of highlighting the discrepancy and the power of asking the client to present the arguments for and against change. Even if they're not ready to make some change just yet, you're planting the seed, and hopefully they will walk away and reflect on the conversation and start thinking about what I could be doing differently moving forward. Okay, so, but what happens when we're working with a client who is resistant? I don't have a lot of time to go into this information, but I'm going to show you a video in a moment, which really summarizes and showcases these 4 principles quite nicely. So asking lots of open-ended questions. We want more than a yes or no answer. Make your client work for you. The moment you ask a closed question, then you have to ask another question and another question, and you're doing most of the work and possibly most of the talking. So, ask the open-ended questions to allow the client to reflect and give you deeper meaning and deeper information about what's going well for them or not so well. Affirm some change. So we really want to focus on those baby steps, what they are doing moving forward. I want to affirm that this is possible for them, that change is achievable. And as the clinician, if I believe that change is achievable, then they're more likely to take action. But if I don't believe that change is possible and achievable for them, I can assure you that your patient will walk away and won't make an attempt. So my physio would say this all the time. I believe that it's possible for us to get to a point for you to be able to manage your knee pain and possibly even reduce it. It was very, very empowering. And I felt really valued and acknowledged that he was working with me to address my knee pain and to work towards reducing it. Listening reflectively is also very, very powerful. We don't do this often enough or well enough because we're very quick to go into advice giving mode. When we're listening reflectively, we're paraphrasing key points, key phrases. We might be guessing as to the meaning or the unspoken meaning. We might be picking up on the client's body language. So I encourage you to guess. Use your intuition, use your gut, and say something like, I'm guessing from what you're telling me that you're afraid of failing because you've tried so many times before. And I'm not afraid if I'm wrong, my client will just correct me. And they'll say, no, Stav, I'm not afraid of failing. I'm afraid of my family because they're not going to cope with these sort of healthy lifestyle interventions that I want to implement. This then allows me to start reflecting on what can I do with the family? Is it possible to invite the whole family in? We do a family-based intervention. So it allows you to shift conversation. It also allows you to move through conversation quite quickly by listening reflectively and by guessing at the unspoken meaning. And summarising is pretty straightforward. We'll see this now in the video quite nicely, where the GP is working with a patient, wants to address their weight. However, this patient is very angry from the outset. And they're angry from the outset because they've been kept waiting in clinic for 45 minutes. So they've been kept waiting, and now the GP has to manage this, but also start reflecting on, well, how am I going to touch base and address their weight, and how am I going to raise this in conversation? So if we can just play the video, that will be great. So I'll pass it over to the IT people. And do we have any more questions or comments, Sandra?
We've had a few comments from Karen, and it sounds like Karen's got a fantastic service that she's running at the moment. A lot of the strategies and ideas that you've put forward, she's already implementing in her practice, which is fantastic. She's got a separate weight clinic, the healthy eating clinic that she refers people onto.
Great.
the last comment that she said was around what you were just talking about, like the change in what's important, changing the mindset of, these are your pros and cons.
Yes.
And she talks to her patients about their brain being like a grumpy old man that doesn't want to change.
I love it.
And then, encouraging them to make that change, and they'll meet the new version of themselves, which can be quite confronting to them.
Yeah.
And she finds that works quite well with most patients in her clinic. So, yeah.
Great, I love that. And I love that analogy of using the grumpy old man, because we are set in our ways, and what we are trying to do is rewire that brain and move towards a different way of being.
I don't think it's the case that people are either not motivated or motivated. And in fact, motivational interviewing was born from conversations with very, very difficult people who were classified as not at all motivated to change and very resistant to treatment. Well, Mr. Smith, that's your medication sorted out.
Good.
Blood pressure's a little on the high side.
Yeah.
Okay. I wonder if I could raise the subject of your weight.
What?
I wondered if we could spend just a couple of minutes talking about your weight.
You are joking, aren't you? I mean, look, I've made time in my day to come here.
Yeah.
I'm kept in your waiting room for 45 minutes.
Yeah.
It's not acceptable.
Yeah.
If I make an appointment with
Yeah.
a client for 10, I expect them to start at 10, not quarter to 11.
Right, and so you're busy enough. And
I've got other things to do. I've got
Yeah.
accounts to do. I've got clients to coming in.
Yeah.
You know.
Yeah. And it wasn't necessarily easy for you to make the time to come down, and you had to wait in the waiting room. And now I raise the subject of weight.
Yeah,
just
I mean,
when you're
okay,
thinking
fair
of going.
enough. I've got to have my blood pressure
Yeah.
medication changed, but I
Yeah.
really haven't got time to talk about my weight. I mean, I'm aware of my weight, I'm aware of the problems, and I'm also aware of the solutions.
Right.
So I don't really need a discussion. It's just I've got too much to do at the moment,
Right, and so it's been a bit of a rush for you coming in.
Yeah.
And I'm sorry about the wait in the waiting
Well,
room.
it's bad form,
Yeah, that's not easy for you, because you'd like to go really soon, and here I am asking you to spend just a couple of minutes with me.
Yeah, but basically I've got things to do. I've got to get back to the office. I've got a pile of work that I've got to deal with.
Yep.
And every moment out of my day means I have to work in the evening or weekends.
It counts.
Or when you're self-employed, you haven't got a choice.
Exactly. It's up to you. Just a couple of minutes.
Well, I'm here now, so okay, if it's a couple of minutes,
I promise.
Okay, because I really must get on.
I want to simply ask you how you feel about it.
About what? What, losing weight? Well, obviously I want to.
Yeah.
I mean, who doesn't? I mean, I'm aware that I'm over my balanced weight, but I know that it's causing problems. I mean, obviously, I get out of breath if I have to do something a bit hurry, and I realise that I'm on this blood pressure.
Right.
And maybe that's probably contributing to it.
Right. So you can see the links between your weight and your health, and you'd like things to be
Yeah,
a
I
bit
mean,
better.
there are other things, but I mean, the weight is something I would like to get hold of, get a handle on.
You'd like to if you could.
Yeah, I mean, I know the theories of a bit of exercise on a regular basis, a balanced diet, but unfortunately, because of my lifestyle, because of being self-employed as an accountant, it's finding the time to exercise, but also finding the time to sort of think, okay, I'm going to go shopping for this, that, and the other, and then I'm going to prepare a meal.
Yeah.
With me, it's very often
Ready meals and that sort of thing.
Food on the run, grazing.
Let me see if I can summarize what you've said, and then we'll see what next. You lead a busy life.
Yeah.
You run a business and you've got a lot to do.
Yeah.
You're aware of the links between your health and your weight, and you are concerned to some extent about that. And ideally, it sounds like you'd like to do something about it. It's just that your life is busy and rushed, and you tend to use convenience foods in order to get the work done.
Yeah, I mean, to a certain extent, because of my lifestyle, food is just fuel.
Yeah, yeah.
You know,
Yeah.
because I'm juggling all these balls and I don't want to drop any.
I get it, I get it. And so if you could fit it in, you would like things to be different, but that's not so easy.
No.
Okay. Can I suggest that you come back and see me in a couple of weeks' time just to chat about this?
Okay, I'm up for that, but it's going to be the same problem of A, finding time,
Right.
and B, if I make an appointment,
Right.
I don't expect to be kept waiting for half an hour or
Exactly.
whatever, because it's...
Exactly. I'll tell you what might be a nice solution is if you come down first appointment, and I give you an appointment at 8:30.
That'd be good.
Then there'll be absolutely no waiting. And the purpose of that visit will be to have a look at how you really feel about how you could move forward and somehow fit in a more healthier lifestyle into the busy work life that you've got.
I'll maybe have a look at my schedules, see whether
Yeah.
anything can be arranged or I can pass something
Yeah.
on to some... and so that so
See.
it's not a wasted interview.
Yeah.
So I can come here and say, okay, I've looked at my schedules, I've looked at things,
Good.
whatever.
Good. And see if you can fix it up and also give some thought to what we've talked about.
Yeah, of course.
Good stuff. Okay.
Okay, thanks.
Okay, all
Sorry I
the
went off
best
a bit.
then.
So normally if in a face-to-face training, I would open it up to you. So I would like to open it up to you and reflect on what actually you noticed in that video with the GP and the patient. You know, what did the GP do well and how did he re-engage him in conversation? So I might just give you a few moments to reflect and see if we can have a couple of contributions from the audience before I sort of highlight some key points. Anything, Sandra? No, not yet. Oh, yeah.
So Karen has said that his reflective listening was good, and Shelley has recognised that acknowledging his emotions at
Yes.
the time
Yes.
is a good strategy.
Absolutely. Yeah, absolutely. So he does that very nicely where he does listen reflectively. He summarised that very, very nicely. And that just took a few moments for him to summarise the client's story. I don't know if you remember, he asks the open-ended question, how do you feel? And that then allows the client to reflect on how does he feel about his weight. What I also think he does well and I like is that he plants the seed for the next conversation. So asking the client pretty much to do some homework, to go away and to reflect on his eating patterns and to reflect on what he could be doing. The GP says something like, if you could, you would. So I think that's very, very powerful. If you could, you would. He's planting the seed and really diffused the anger quite quickly by acknowledging and by apologising. He didn't give any reasons for it, but apologised and also came up with a solution for next time by booking him in early for an early appointment to really engage him to come back and have that conversation. So feel free to follow up and continue the conversation, especially if you feel the patient is in a hurry or they've come in for one thing and now you're asking them to think about another. Plant the seed and do that follow-up, which I think is very, very important. So they're just a few highlights and a few points, and I've got a few others that have contributing.
Yeah, a couple more come through. So Donald recognised the good paraphrasing and summarising of the consultation.
Yes.
And Nazir noted that he had explored and found out what the patient's concern was about his weight.
Yeah.
And Shelley, just adding on to her previous comments, is about having the persistence to put the strategies into place, even when the client was trying not to talk about that, and but doing that without being too pushy.
Yes, exactly.
It's obviously a very difficult skill to master.
Yeah, absolutely. So he didn't give up the GP. He planted the seed and he kept continuing to engage in conversation in a supportive way. And I think that's important when we are working in this space, that we don't give up, that if we do feel like, oh, they've ruffled our feathers, we're just trying to stay as neutral as possible, stay calm, take a breath, pause, ask an open-ended question, and allow them to reflect on that for you to then be able to gather your thoughts. But a really powerful tool of motivational interviewing is developing your poker face and, you know, keeping as neutral as possible, because sometimes your patients may say things just to push your buttons or to get a reaction out of you. And this is what we don't want in clinic, in conversation. We want to support them to work towards a goal that is right for them. So the last part of this evening's webinar is to focus on some strategies, and in particular take you through the Live Lighter website, as well as highlight the 5A's framework. So just to start off by acknowledging the National Obesity Guidelines, and if you haven't had a chance to look at these guidelines just as yet, I really encourage you to do so. It is a very comprehensive resource on how to tackle someone being above a healthy weight in both adults, adolescents and children. It has unfortunately been currently rescinded due to it being over 5-6 years out of date. I'm not sure whether there are plans to redo this, but at this stage the evidence is still quite strong. There's a good evidence base there. All it needs in terms of updates is an update on some of the medications and maybe a little bit more information on mental health. But overall, it's very comprehensive, it's very thorough, and I encourage you to have a look at it when you get a spare moment. So as part of any sort of weight management plan, it's important to reflect on, you know, a couple of key points. So having an action plan is crucial. Setting some realistic goals with your patient in collaboration. What is it that they would like to do? How would they like to proceed? How do we set a goal, and what kind of a goal are we setting? And is it smart? Is it specific enough? Are we able to measure it? Is it achievable for our patient and realistic? And does it have a time frame attached to it? Obviously, we want to really encourage a healthy dietary intake, but what is this, and you know, what is a healthy dietary intake? So we'll talk about Live Lighter in a moment. We know from the research that keeping a food or exercise diary can actually more than double a person's chances of success. So, you know, and there are a lot of apps now online where you can do this. You can take a photo of your food and all sorts of things. We want to be mindful of portion sizes, because over the past 20 years, they have more than doubled. And a new concept is eating mindfully. So you may even wish to introduce that into your practice about, you know, really savouring the taste, smelling that food, eating slowly, being mindful of what you're eating and how you're feeling, rather than sort of rushing or eating quickly or eating in the car, which is sort of often mindless behaviour. And of course, prioritising exercising, moving the body on a regular basis, do what you can in terms of physical activity. And I'll give you some examples in a moment as I take you through this section of the webinar. So this is Live Lighter's homepage. Live Lighter was born in Western Australia in 2012 and is currently delivered by the Cancer Council of Western Australia and funded by the state government. In Victoria, Live Lighter is delivered and funded by the Cancer Council of Victoria, and it is an informative resource to not only raise awareness about the effects of being above a healthy weight, but also provides you with some practical tips and ideas of what to do, how to, you know, have a healthy dietary intake, and also to reflect on other lifestyle topics, which I'll highlight in a moment. It is a very easy to navigate website. It has a couple of sort of key tabs that focus on the recipes and focus on the calculators, which I'll highlight in a moment. But it also has this sort of tab at the top where you can click and find some relevant information, and the health professionals one is an important one. So I encourage you to have a look in there. It has information tailored for health professionals, including additional, you know, professional development in this space. So I encourage you to have a look when you get a spare moment. This is free for anyone and everyone to access, and you might even work through the website with your patient in practice if you have a little bit more time. So there are a number of healthy recipes available. Not only are they nutritious, but they are also delicious. And often they're very easy to make with an ingredients list, a shopping list, a very easy sort of description of how to make it, lots of different snack ideas, lunch ideas, and so on. As part of the Live Lighter program, there's also a Live Lighter meal and activity planner. So you can actually put in your measurements, and you can actually highlight your, you know, your current weight, your current BMI. And what we find is that it's not only the data that people are looking for, but they love this figure here. So consumers love seeing this figure become slimmer and slimmer, which is really interesting because you'd think that's the last thing that you'd be looking at, but they absolutely love this aspect of the program. You don't have to fill fill in these details to access the program, you can still access all the recipes and all the information without having to put all of this data into the program. Now, Live Lighter offers 3 free and 3 type of meal plans. So we have the 3-2-1 meal plan, where the dinners are often set and you have much more freedom to choose your breakfast and lunch. The 12-week meal and activity planner is much more set, so all meals are included. And this is for the consumer, the patient that says, just tell me what to do and I'll do it. So as you progress through the 12-week program, there's a lot more guidance for you to then start thinking about, well, what can I be eating? What can I swap this for? So it's starting to build your skills post-program. And the family meal plans have a dinner plan for families to download, and they have been tested with families and with kids, and they're often very, very popular with the whole family. So this is often what it might look like on the website. So they're kind of tiles that you can move around and up and down and sort of move, you know, your breakfast and your lunch around. There are vegan options, so in terms of special dietary requirements, and vegetarian options. If there is a question that the consumer has, they can just ask us, and a dietitian from the Live Lighter program will answer their question. So it's very interactive in that sense, but also very easy to navigate and very easy to use. There are a number of calculators, and I think this is very, very powerful. In fact, I actually encourage you to get on and do this calculation. So often when we talk about sugary drinks, often people just think about soft drinks. They're not thinking about the fruit juices. They're not thinking about the energy drink. They're not thinking about the iced coffee milkshake. They're just thinking about soft drinks. So it's important to have that conversation. And if you can, put this up on your, on your browser and go in and then calculate how many soft drinks or sugary drinks are they drinking. And this comes up with a calculation in terms of sugar and so on. And also the same for the junk food calculator. And there's an example there on the right, which highlights the number of kilojoules eaten for this particular junk food, how much money you spent on junk food for this week, and how much of your energy is from junk food. That is so powerful. Very, very visual, and it has all different types of junk food. So it's a great tool, and I strongly encourage you to get online, have a look at it, and also do this together with your patient in practice. You can then print off the fact sheet and pass that information on to your participants, your patients. This one just highlights the food and exercise diary. There's nothing more to say about this other than really reflecting on not only what your client is doing or not doing and what they're eating, but also how they're feeling, which is very, very important if we're connecting from that emotional perspective, especially when we're working with emotional eaters. So the website has lots of top tips, and again, these are all downloadable fact sheets, and I'll show you some ideas in a moment. So it's not just focusing on sugary drinks, it is about cutting back on your salt and cutting back on alcohol, choosing the healthy snack, and they're very easy to read. When you look at these fact sheets, there's some visuals there talking about portion sizes, how they've increased over time. Very, very powerful. So you can download these free of charge. You can print these off in practice and hand it over to your patient. You can refer your patients to this website. So it's very, very easy to navigate. What also is available is these pocket-sized cards, which allows the patient to reflect on food reading, really food labeling, and to reflect on, well, how much fat does this food product contain, or how much sodium and how much fiber and so on, with some, the green, the best choice, the traffic light system, which is very, very powerful. So I often encourage patients to carry this little card in their wallet, or do a screenshot and add it to your phone, put it in your back pocket if you're out shopping, just to give you an idea about how can I make a healthier choice, and what exactly am I eating, or what exactly am I feeding the family. It is one of the popular sort of top orders that we often receive from consumers. There are also a number of other sort of booklets and resources. Often we hear patients say, well, it's too expensive to eat healthy or feed a family this healthy diet. But in fact, you can shop smart. And these booklets just give you some ideas about shopping smart and some ideas about how to cook and how to make those foods last for a lot longer. Like dinner for 4 for under $100 a week. So really, really powerful. And again, I encourage you to get online and have a look at these resources and pass them on to your patients. There's lots of information available for Aboriginal and Torres Strait Islander populations. So again, tailored for this cohort with appropriate colouring. I encourage you to use these resources if you're working with this community. And there's a couple of other more resources that I'll take you through. I don't need to tell you the benefits of physical activity. Many, many benefits, not just improving our physical health, but obviously our mental health. And any activity is better than none. And I often use the example of a man who was struggling to do any form of physical activity, low self-esteem, low self-confidence. And so what we asked was, could you walk from your couch, from your lounge to your letterbox 3 times a day? Could you? So we're planting the seed, we're seeking permission, we're asking a question which allows them that freedom of choice. And he said, yeah, of course I could do that. So he was able to do that 3 times a day. And then we sort of built on that. Now, could you walk from your letterbox to the end of your court? Yeah, I could do that. And so he did that. Now that you're at the end of the court, could you walk to the end of the street? Yes, I could do that. And this man is currently walking 30 minutes a day. And all we did was ask him, could you walk to your letterbox? So plant the seed. Encourage them to reflect on what they could be doing. Another example, and a personal example, is my cousin who is recovering from breast cancer and through her treatment put on a huge amount of weight. She's been very successful in being able to lose 20 kilos. So amazing, amazing achievements. And so we were having this conversation about increasing her steps, increasing her physical activity. And I said to her, what did you do? How did you get moving when you were feeling so low and recovering from breast cancer and all of that? And she said, which really blew my mind, because I thought to myself, there really is no excuse. She said, Stav, all I did was just walk in front of the TV, just steps up and down. She goes, I had my pedometer and I just walked in front of the TV for 10 minutes. I calculated how many steps I had taken in those 10 minutes. And then I laid back on the couch for an hour or maybe an hour and a half. And then I got up for another 10 minutes just in front of the TV. And I thought, wow, that is so inspiring. And so she was able to then, do more than 10 minutes. She was able to then go out in public and walk along the street. And more recently, she visited our grandma, who's 45 minutes away from her home, from, walking. And my grandma said, you walked here? What do you mean you walked here? She goes, yeah, it was 45 minutes. And I've got 45 minutes back. It's so inspiring, because often we say, oh, I can't do this, or I'm homebound. There are always ways around improving our steps per day, and using those examples can hopefully inspire other patients that change is possible and that change is achievable. So again, just highlighting some of these fact sheets, whether it's avoiding the sugary drinks or quitting smoking, really highlighting being active every day. So really nice visuals to support the behaviour change conversation. As part of your role, it's also important to have a conversation about medications that as a side effect may have weight gain attached. So have that conversation with your patient, plant that seed about how will we manage this? What are those food choices? How is it affecting their cravings? Are they motivated to be active? Have they noticed a change in weight? And there's some practical strategies to consider, especially if they're feeling tired and overwhelmed. Maybe they could cook up a few meals and freeze them. Maybe they need to reflect on their snacks and their drinks in the evening. And talking about breaking exercise into smaller goals. But I think it's really important that you have that conversation, and that you have this conversation about how can we maintain this, or how can we prevent you from putting on any additional weight. Okay, so now, so that was just a very quick snapshot of the Live Lighter resources. The last part of the webinar this evening is to focus on the brief intervention advice and how we can actually put this into practice. And what I love about the 5 A's is that you don't need to do all of them. You can do the 2 A's or 3 A's, you can ask and then arrange a follow-up by referring on to a dietitian. Now, the 5 A's were initially developed for smoking cessation, and they've been so successful globally that they've decided to now use them for any type of lifestyle behaviour and intervention. And so what we're doing with the 5 A's is engaging in conversation quickly, within 3 to 5 minutes, and we're tailoring our approach depending on our resources, depending on our time, depending on our level of confidence. So let's work through each of the A's, and I'm not going to spend too much time on each of these A's because they are so self-explanatory, and a lot of this you will already do in practice quite intuitively. So the first A is ask and assess, where we kind of bank those two together. And all I'm doing is I'm assessing current lifestyle behaviour. I'm assessing current weight status. I'm assessing comorbidities and other chronic conditions. So I'm making an assessment of the person and where they're currently at. As part of my assessment, however, I'm also assessing their level of readiness. How do they feel about making some changes? How can I help and support them? How confident do they feel? As part of these two A's, I'm also measuring waist circumference and calculating BMI, and I'll just touch on those in a moment. So as part of assessment, this is straight out of the guidelines, a screenshot on page 50. All it does is highlight that what we're doing is encouraging the client to feel comfortable. This is what we do as part of our duty of care, that we're using neutral and language that it doesn't stigmatise, and that I am going to involve other health professionals if that's appropriate, whether that's an interpreter or I'm going to link them in with their Aboriginal health worker. So as part of assessment, it is important that we do the waist measurement, and this is how we measure abdominal obesity, which is much more dangerous, that fat around the organs rather than fat under the skin. And we have a couple of centimetres there in terms of increased risk of chronic ill health. And it's important that you do measure this regularly because this might be the focus. The focus is away from the kilos, and the focus is maybe the reduction in waist circumference, and even a couple of centimetres is a great start. So it's important to do this regularly so you actually have some data in order to present back to the client, especially when they're making some progress, and especially when they're saying things like, I'm not losing any kilos, I'm not making any changes, I'm not seeing any shifts. But hey, in fact, you have dropped a couple of centimetres around your waist. Have you noticed that in your clothing? That can be very, very powerful. It's important to be mindful about how you measure, and it's especially if the person is quite large. We really want to avoid doing this. The avoid going around. We want them to sort of put their finger on, and you get them to spin around. So you're then able to take that calculation. That's very, very powerful, and is not so awkward with you having to stretch your arms around the patient's body. So waist circumference is part of assessment, and so is calculating your client's body mass index. It's a measure of body size, obviously. We're assessing the risk for mortality and morbidity. We acknowledge that BMI is not perfect without the DEXA scans, but currently it is considered best practice. Currently it is being recommended. Currently it is what we do. It also allows us to kind of gauge our approach and how we intervene. And I will show you a summary table highlighting ways of intervening depending on your patient's BMI. But you may just decide to focus on waist circumference. You might just decide to focus on other sort of biological markers in terms of having this conversation. I encourage you to do what you feel is right and use your clinical judgment in terms of this conversation and in terms of assessment. When we're working with families and children, this is a very sensitive topic. And as I started my intro with, little Johnny looks like all the other kids, it is becoming normalised. And many families and many parents may not realise that their kids are actually above a healthy weight. So I've been doing a lot of work with the New South Wales government, the Ministry of Health, where we're actually going in and training any clinician that sees children. And what's happening in New South Wales is that it's becoming mandatory that any clinician who sees children does a growth assessment. And as part of that growth assessment, if the child is identified as being above a healthy weight, then the clinician engages in conversation with the carer or the parent and talks about healthy lifestyle options. Now, I'm not going to take you through this information, how we approach this subject in terms of assessing children, but what I do encourage you strongly to do is visit this website, the pro.healthykids.newsouthwales.gov.au. It has lots of great information about how to engage in conversation, how to raise the issue, but it also has videos with doctors working with parents. It has a video with a parent who's saying, what's this got to do with asthma? And I came in for asthma, and now you're asking and assessing Johnny's weight. So it's very, very powerful. So I encourage you to have a look. I encourage you to download the resources, any information that you might need to be able to engage in conversation. Let's nip this in the bud early. Engage in conversation with parents and their children early. Nip it in the bud, because as I've highlighted, and I'll highlight again, obesity is very difficult to reverse. So we want to intervene early and have this conversation. As part of assessing readiness to change, we also may want to ask these additional questions. How confident do you feel that you can change your eating patterns? And if your client says, oh, actually not very confident, my cooking skills are bad. I actually did some training the other day and a clinician said, I hate cooking, so I order Uber Eats. I couldn't believe it. A clinician, an evidence-based practitioner, very senior. So have these conversations. Don't assume that people know how to cook and actually even enjoy cooking. Reflect on positive feelings. How do you feel? How would it feel if you were to succeed? Do you believe it's worth the effort? Can you picture yourself changing? How do you think your family and friends will react? They may say, oh, my partner won't like it. Maybe it's threatening for the partner. Maybe it's not. Is there someone who can help you? These are really powerful questions to assess not only their level of readiness, but also to assess what else is going on in their environment, and especially with their families and friends. The third A is to advise. So we've asked and assessed, and now we're going to advise, and we're going to use our clinical role as your doctor. I would like to emphasize that a very important thing that you can do for your health is to consider addressing your weight, is to consider managing your diabetes, is to look at reducing your blood pressure, whatever it is that you'd wish to hone in on. Very, very important. So it's a very clear statement without judgment, and then you may want to personalize it by linking into that various health condition, whether it's mental health, whether it's chronic knee pain, whatever it might be, sleep apnea, whatever it might be. Also convey to your patient that even small amounts of weight loss will improve their health and well-being. And the guidelines highlight this data with the levels of evidence. So whether we're focusing on cardiovascular risk factors or sleep apnea, kidney disease, musculoskeletal problems. And the last one, advising improvement in quality of life, self-esteem and depression may improve, even with small amounts of weight loss. So have these conversations, plant the seed, raise their awareness. Possibly the focus is on mental health and improving mental health. The fourth A is to then assist. So we then start focusing on developing a weight management program. Now, this assistance phase very much depends on you. It very much depends on how much time you have, whether you feel confident moving forward. You might just decide to make a referral. So have that conversation with your patient. You may decide to refer on for bariatric surgery because this is the option for your patient. You need to assess their risk factors, comorbidities. You may need to then check in with them again more often. You may need to make a referral to a psychologist to discuss their, emotional eating, or their trauma of being abused as a child, or whatever it might be, the grief that they're experiencing. So you can spend a few minutes here. You can plant the seed. You can invite them in for another consultation where you explore this further. It is entirely up to you. You might even bypass this phase and make a referral straight away. So that's what I love about the 4As. You can tweak them and tailor them and to suit you and your practice and what's appropriate for you and your patient. If you are pressed for time, it is really important to focus on those short-term goals, especially with patients who might be struggling to lose some weight or to address their weight. So focus on increasing the frequency of eating vegetables. Focus on non-hungry eating. Are they in fact thirsty? And that's what's leading them to snacking. Could they do a little bit more sort of physical activity? But let's focus on reducing your blood pressure and so on. So focus on treatment goals as a way to engage initially in conversation, and then as the trust and the confidence builds, you can then do more formal action plans. If you're really pressed for consultation, the Live Lighter and the Cancer Council's perspective is that we focus on sugary drinks. And we know that when people make changes to their sugary drinks, we see huge benefits. And the same with eating vegetables, a great way to fill up the plate, and obviously a great way to reduce our risk of developing chronic disease, filled with vitamins and minerals and nutrients and so on. develop and focus on a couple of realistic goals that are achievable and realistic for your patient. And the final way is to arrange a follow-up. So check in again to see how your patient is progressing, and I'll show you a timeline of how we do this in a moment. You know, reflect on how you might be able to help, reflect on whether they need ongoing support and encouragement. If you are working with a patient who has a mental health condition, we do need to provide that ongoing support. We do need to provide much more intervention. We do need to repeat and reinforce those key messages. It's a slow and steady approach, and one where we have lots of patience when we're engaging in this conversation. Support a self-management approach. What will they do? How will they move forward? How will they manage their mental health? How will they manage boredom and sadness and grief and so on? So in terms of timeline, this is what the guidelines recommend. And you'll notice there that initially we're aiming to see them fortnightly and make a review of their plan. And we do this because a lot can happen in 1 month's time. If our patient goes away with an action plan, which they then start to put into practice, but then it falls by the wayside or it's not really working for them, we won't know until the next month, and maybe they won't even come back, so we won't know. So I often say to patients, whether it's working or it's not working, I really want you to come back, and I really want us to touch base again to have this conversation about how this is working for you, because if it isn't working, that's okay, and we can tweak the plan and make some changes to suit you and your lifestyle. Now, this follow-up doesn't necessarily have to be face-to-face with even you. It could be an allied health assistant, gives your patient a call to check in on them, to see how they're progressing. It could be an email to check in to see how your patient is progressing. So don't feel obliged that you have to see your patients face-to-face fortnightly initially. It might be use the practice nurses to support this conversation. And then you might blow that out to 1 month consultation and then come back in 3 months and so on. And they've just got outlined some information there. In terms of a summary and the BMI and how we approach our patients, this is also a really nice summary of what we could be doing depending on the client's BMI. So you've got the BMI 30 plus, and we provide much more active, intensive intervention by working through these A's. But what is missing from this chart and what needs updating is, let's have a look at BMI of less than 25. And if you notice, we still go through those first couple of A's, but then there's nothing for assistance. It's important that we then have a conversation and ask our patient, what are you doing to keep so healthy? And prompt, tell me about your dietary intake. Tell me about how you're managing your stress. Tell me about your levels of physical activity. And I want you to keep doing what you're doing. Record that information, because when you're working with that patient again, who has put on weight for whatever reason, you can go back to that and use that as an incentive, use that as a form of inspiration to encourage your client that this is possible, that they can move forward in a positive way. So be mindful of having that conversation and really encouraging people who haven't put on weight that they're doing well to be able to maintain their weight. So this pretty much brings us very closely to the end of the presentation. To summarize, if you do have a window of an opportunity, I really encourage you to focus on those benefits. How could your life be different? What would life look like for you? And here are some of the benefits, focusing on both physical, both mental health benefits. It might be the role modeling aspect. Explore those pros and cons. Let the client do most of the talking. Let them do most of the work. Let them tell you what's important to them. Discuss concerns, discuss those challenges, discuss what gets in the way. If it's stress, I have to help them address it or refer on to help a counsellor to help them address it. If it's family, then I need to actually work with that. What's going on for them? Explore previous successes and encourage that potential to change, and also acknowledge that what the patient is doing is developing new skills, developing coping strategies, and use that analogy of the grumpy old man. Use the analogy that we're very much set in our ways, and what we're aiming to do is rewire and recreate new habits, which take time, which means that we need to be consistent with those habits every day, so they start to become much more routine and much more natural. And sometimes I might use the example of, how much thought do you put into brushing your hair or brushing your teeth? And they go, huh, what? I just do it. Exactly. You just do it. You just brush your teeth. You just brush your hair. How much thought do you put into having a shower? I just do it. It's part of my routine every morning. Great. So let's look at how we can make this part of your routine. How can we make this lifestyle choice part of your everyday routine? So it becomes consistent, it becomes habitual, and it gets to a point where I don't even think about it. I just do it. And that's very, very important and very, very powerful. So what are the 5 A's? Normally in a face-to-face interaction, I would ask you to reflect on what those 5 A's are. And I'll give you a few moments to think about what they are. Do you remember what those 5 A's are? But they are to ask and assess, to advise, to assist where we can, and to arrange a follow-up or a referral to a dietitian, to an exercise physiologist, to a physiotherapist, to a counsellor. Remember, you don't have to follow each of the A's. You might just make an assessment and then do a referral, or you might jump straight into assistance because you've already made that assessment in a previous consultation. So the last part of the webinar is to focus on a case study. So I put up a case study, John, up there for you, and I want you to reflect on each of the 5 A's and what you might say or suggest under each of these A's and how might you help this particular client. So I'll give you a moment to read that and jot down some ideas, and let's have a conversation about, you know, those first couple of A's initially. And I look forward to, you know, hearing your thoughts about how you might help by working through this 5 A structure. How are we going? Have you thought about what you might ask and assess John, a 45-year-old man? He has high blood pressure, discloses that he has put on weight since having his first child, but he also works in a company where entertaining clients is part of the culture. He reveals that his nutrition isn't as good as it could be and that he also finds it difficult to find time to exercise.
So a couple of comments that have come through asking him how is he feeling about the change to his life since having his first child.
Nice.
Assessing has the level of stress he's experienced increased since the birth of his child.
Yeah, good.
And more of an observation that his job results in sedentary lifestyle and unhealthy habits with all the entertaining that he seems to be involved in.
Yeah, exactly.
I'm not sure how his wife would feel about that with his new child.
Absolutely.
Maybe that's adding to his stress. Assessing his BMI and waist circumference and his current exercise level. Yeah,
great. Absolutely. So right, bang on right there. So you're making an assessment about his current lifestyle, his current situation, doing the waist circumference, calculating the BMI. But I also love that you've added in that you're assessing his stress level. You know, what exactly is going on, but you're also reflecting what has changed since having his first child, because a lot can change and a lot does change. So it's really nice. And you've done that very, very quickly by just asking and reflecting on those couple of key points. Let's move on to advise. What might you be advising John in this stage? And we could even do advise and assistance in that same sort of, you know, phase or paragraph. What might you be suggesting for advise and assistance? He has high blood pressure. So as John's GP or health practitioner, how would you help? What might you suggest here and what type of assistance might you offer? Any thoughts coming through? Give you a few moments to type in. So as you can see, it's very straightforward. You already do this intuitively. All the 5 A's does is provide you with structure. Somewhere to go if you feel a little bit lost in conversation or consultation. You might think, well, I've already assessed their current weight situation. Now as their GP or as their health practitioner, I am going to advise, I better not give away the answer just yet.
We've had a few comments.
Oh, perfect.
Now. So advise a change of lifestyle involving more walking, at least, even if that's indoors to begin with.
Yeah, great.
And also advising, although he may feel more pressure to entertain clients in his company in order to provide for his child and partner, there are ways to make healthier choices, even though when he is entertaining.
Yeah, good.
Lifestyle modifications, first-line management and high blood pressure.
Yeah.
Seek home-cooked food, mindful eating, considering portion size, nutrition content, and asking him whether he can think of anything he can change himself, get him to think about what might be important to him.
Nice, yes.
more walking, diary of his usual diet to discuss suitable changes.
Great, excellent. So well done, excellent. One thing you have missed is referring to the Live Lighter program, the website. But well done in really exploring those options and focusing on those lifestyle modifications and encouraging the exercise diary, or asking John to reflect on what he could do, and, you know, using resources that are available. So use the Live Lighter program. I think it's Karen mentioned in the notes that she often has, you know, a bundle of resources available ready to go. And so do give away your patients something to take home, something to reflect on. Don't underestimate the power of grabbing a blank piece of paper and just making a note. I know that sometimes I carry pieces of paper that my GP has given me, and I have that as a reference or as a bit of a reminder, and that can be very, very powerful. Remember that most of us are visual learners, so if you can, you know, write something on a piece of paper, draw something, a picture, give some information, give away those fact sheets. They're very, very visual, which much more likely to look at it, much more likely to remember it, and hopefully much more likely to take action moving forward. And then the final A is to arrange a follow-up, and you know, that could be a referral to the dietitian to have really explore his nutrition, but also arranging a check-in point just to get John to come back and see you. You know, how are you going, John, with some of these lifestyle modifications that we've discussed? You know, how are you feeling? You know, what's working well for you, what's possibly not working well for you. So very, very straightforward. And I'm so pleased that you were able to come up with those ideas so quickly. Was there anything else, Sandra, there that...
A couple more come through regarding stress reduction.
Oh,
and,
perfect.
Adequate sleep.
Oh, nice.
And the last one was maybe involve his partner in that conversation.
Yeah.
So that they're in that together.
Great. I absolutely love it. I absolutely love that you're involving the partner and that you're focusing on sleep and stress. I run these presentations with face-to-face training sessions, like I said, for the past 5 and 6 years. And I think this is the first time that the audience participation has mentioned sleep, stress, and family. So I have to commend you. And I wish you were here in front of me so I can actually, you know, say, great, thank you, because it's very heartwarming on my part to know that you're able to move with this information moving forward with your patients. So this pretty much brings us to the end of today's webinar. Just another sort of plug for the Live Lighter program and the health professional section of the Live Lighter program. So please log in, have a look at the information available for you and your patients, and please feel free to get in touch as well if you do have any further questions or comments. So this brings us to the end in terms of what we've covered today. I started off by setting the scene and how important it is that we engage in the conversation that obesity is rising within Australia at very, very high speed. We talked about the behaviour change process and that often most people can be contemplators and stuck for a very long time, but we've also looked at pre-contemplators and what can we do with pre-contemplators, but also acknowledging that obesity is a chronic relapsing condition and that it's important that we continue to engage in a neutral way, in a non-stigmatising and supportive way. I also touched on motivational interviewing as part of that sort of conversation, and we looked at that video with the GP who summarises and reflectively listens quite nicely. And then I took you through the Live Lighter program, highlighted some practical strategies to manage weight gain. And we finished off by looking at the 5 A's to help you put this into practice quite briefly, so provide that brief intervention. We worked from a case study, and again, well done to you. Thank you so much for your contributions. And this pretty much brings us to the end of tonight's webinar. Please feel free to get in touch if you have any further comments or questions. I do run motivational interviewing workshops in Melbourne, so if you're ever visiting, please don't hesitate to drop me a line or come along to the training if you wish. And Alison McAleese is the Live Lighter contact in Victoria, and Anne Finch is the Live Lighter contact for Cancer Council Western Australia, if you do want any further information from a Western Australian perspective. But thank you so much for your attendance and for coming along this evening. Thank you so much for your contributions. I hope you found tonight's training session interesting and useful. It's giving you some food for thought and also some tips and ideas moving forward. And I do wish you the very best moving forward and working with your patients.
Thank you, Stav. It's been a really great webinar. Obviously I'm not a health professional myself, but I have found it very interesting, and I've certainly some take-home messages that I think that we can all use.
Absolutely.
You can recognise yourself in some of those scenarios.
Absolutely.
Just a couple of the attendees are saying, you know, thank you, like, love your passion for what you're doing, and I certainly mirror that. It comes through very well. I don't think the webinars are easy to do. You don't have a live audience, you don't have anything to feed back of, and you've done it exceptionally well this evening.
Thank you.
So thank you for that. Someone's asked if they can have the slides. I'm not sure if we are able to send the slides out, or do we have a handout or something that we could share?
We can do a PDF, a PDF version of the slides, and send those through to you. That's totally fine. Happy to do that.
Yep, I can do that.
Yeah, we can do this after the session.
So there are no other questions coming through. I would just like to again thank you, Stav. That's been wonderful. Stav, like I mentioned earlier, has come over from Melbourne for a couple of days to help us out with delivering these sessions, and the Live Lighter team have worked very hard today, so I appreciate that you're still working at 8:30 this evening. We're probably still on Melbourne time, so
yes.
We'll wrap it up here.
Thank you.
And thanks everyone for joining this evening, and we hope to see you at more of our events in the future.
Great, thank you so much. Have a good night, everybody. Bye-bye.